everybody. If you've ever experienced pain in the ball of your foot, where it feels like you're walking on a pebble or a stone, or you're having a sharp radiating pain, maybe even numbness in your toes, you may have what's called a Morton's neuroma. Now, Morton's neuroma is a benign inflammation and irritation of the nerve in the ball of your foot. Now, Morton's neuroma is not actually a tumor or anything concerning in that aspect. It's really just a thickening and sometimes even a degeneration of the nerve due to an entrapment in the ball of your foot, which can then lead to these symptoms of pain and tingling and marble or a pebble in the ball of your foot. The problem with Morton's neuromas is they can limit your activity. They can really cause pain and really prevent you from doing the things you enjoy. If we take a look at this diagram here, what I want to point out is that this is if we're looking at the bottom of your foot, and these red lines are the nerves in the bottom of your foot. So you kind of start, as you get back towards the ankle, you have what's called your medial and your plantar nerve and your lateral plantar nerve. And as these nerves course more towards the ball of your foot, you'll see they branch off. As we get up in here towards the ball of the foot, these nerves become what are called your common digital plantar nerves. And you can see in between each one of these bones here, these are called your metatarsals, a nerve courses between those, and they eventually branch off to the sides of your toes up in the foot. Another thing to point out is that when we're talking about your foot, the space between your first and second toes is called your first web space, with the second web space, third space, and fourth web space, right? Now, Morton's neuromas are more commonly formed in the third interspace. You can see them in the second, but it's definitely less common. As you again look at this diagram, some other important things to look at is right where these heads of these bones are, you have a ligament on the bottom of your foot that kind of connects all these bones. This is called your deep transverse intermetatarsal ligament, and it actually sits above the nerve. So you have multiple things in here besides the heads kind of squeezing medial and lateral or to the sides of the nerve. You also have the ligament over the top. And if that nerve becomes inflamed, it can become very, very painful. So what I've done here is I've kind of drawn out the anatomy of the foot, and you can see this little purple lump right here. That's typically where you see a Morton's neuroma. It's just below the, or just proximal and below the ligament there. That's kind of the area where patients feel their pain. While they may feel some radiating down here, they may even feel pain up in their toes. This is where that neuroma starts. Now, the exact cause of a Morton's neuroma, we don't really know, but we do know that it's a compression or a squeezing and an entrapment of the nerve in this area. It's 8 times more common in women than it is in men, and it's usually in response to some sort of trauma, irritation, or excessive pressure to the area. Again, the symptoms that we typically see with this are burning or a sharp pain that may radiate or even cause the toes to spread out a little bit when you put weight on your foot. You may feel like a pebble or a marble in your shoe, numbness, tingling. Sometimes people that run can really feel this pain when they go to push off, when they really start to run. Shoe gear becomes a big problem. High heels or tight shoe gear compress that forefoot, which can in turn really compress on that nerve, exacerbating your pain. So when you come into Elite Foot and Ankle Associates, the first thing we're going to do is get an x-ray. The x-ray is not so much to see the nerve, as nerves don't show up on x-rays. It's really to rule out anything such as a stress fracture or other issues that could be causing pain in that area. The next thing we're going to do is really just evaluate the pressure points and the pain points on your foot. And that may be done by squeezing in the area right above the third interspace or the second interspace to see if that elicits pain. We may also squeeze that forefoot and try to just kind of manipulate the forefoot in hopes to elicit a clicking sound. It's more of a palpable clicking versus an audible clicking, but that is known as a Mulder's click, and that can sometimes be very pathognomonic of Morton's neuroma. So treatments for a Morton's neuroma, starting basically, you're looking at changes in shoe gear, getting something with a more wider forefoot that's going to take some of the pressure off the ball of your foot. Other things can be padding, such as a metatarsal pad, which is a pad where we place right in the bottom of your foot, just behind the ball of your foot in order to reduce some of the pressure. Orthotics can be beneficial. We then look at things like a steroid injection. And here at Elite, we really like to use what's called shockwave therapy and laser therapy. These are really non-invasive treatments that have really good success with Morton's Neuromas. It takes it to a next level versus, say, an injection, and can really get the patient being mobile. We typically recommend 6 treatments with laser or shockwave to really help eliminate some of that pain and the problems associated with your Morton's neuroma. After the conservative measures fail, we're now looking at more surgical intervention. Say if you've done shockwave or you've done laser and those haven't worked, you're looking at surgical intervention. Surgical intervention typically involves 2 types. There's a nerve decompression where we basically just go in and we release the ligament right here around the nerve to try to decompress the area and kind of open up the area to allow the nerve to kind of heal and reduce the pressure to it. That works fairly effectively. A lot of doctors use just that method. Some other doctors, let's say the decompression doesn't work, which typically has about an 80 to 95% success rate, but let's say you had the nerve decompressed and it didn't work. The next step would be to actually go in and excise the nerve, the area that's causing pain. That also has a very high success rate of about 80 to 95%. I don't know that decompression versus nerve excision is better than the other. However, if you have the nerve removed, what I tell patients is you're essentially trading pain for numbness in the toes. As you can see here, if the neuroma were there, that nerve radiates in here between the 3rd and 4th toes. So essentially this area here would be numb because you've resected the nerve. So if you're having those kinds of pains that would seem like it's a neuroma, it's a pebble, it's your socks bunched up under your shoe or under your feet, radiating pain, numbness, tingling, come talk to us here at Elite Foot and Ankle. We have many ways to treat it, both pre-surgically, and if those are to fail, we also have the ability to treat you surgically. So give us a call, 503-668-5210. Thank you.